The American Cancer Society reports colon cancer is the second highest cause of death from cancer in the United States. 50,000 people will die this year from complications of colon cancer. Luckily, though, it is the kind of cancer that can be treated as well as prevented. Whether it's screening, diagnosis, or treatment, doctors at Holston Medical Group make sure they provide the best care. Colon or colorectal cancer can be sneaky.
Unfortunately, there's very few symptoms of colon cancer. The only maybe early symptom can sometimes be rectal bleeding, but other than that, usually they're all fairly late symptoms. Abdominal pain, anemia, iron deficiency, fatigue, they really only come once the cancer is fairly well developed, which makes it very difficult to really find it early.
And that's what happened to Dave Light almost 7 years ago. After ruling out some other illnesses, Light received his colonoscopy and a cancer diagnosis.
Finally, we said, let's do a colonoscopy. And Dr. Schoen found a tumor.
After surgery and rounds of chemo, Light is cancer-free.
I've gotten to see the granddaughters become high school students, and I'll get to see everything okay. I'll get to see them graduate, go to college, maybe get married. If I hadn't had that colonoscopy, I'd be dead.
Dr. Dallas Schoen and the staff at HMG make sure they are up to date on the latest techniques and treatments to give their patients the best outcome possible for their case.
The fact is, I'm alive today because of that teamwork of my primary care physician, Dr. Schoen, Dr. Thomas, the HMG crew.
And they make sure their patients know the risk factors.
The biggest risk factor is really genetics. So if anybody in your family has had colon cancer or colon polyps, then you really should pay attention.
Obesity, a sedentary lifestyle, and use of alcohol are also risk factors. And let's be honest, the stories of the colonoscopy are not pretty, but the procedure is worth it.
The bowel prep is really the worst part of the test, and even that has got better. Most of the bowel preps now are a small volume. They're 2 glasses. You take about 12 hours apart. It's really not the whole gallon, 2 gallons horror stories that everybody talks about.
And Dr. Schoen practices what he preaches.
So really it's not the big ogre that everybody thinks it is. Yeah. I do practice what I preach. I have had 2 of them.
And it completely changed the future.